Hey everybody, my name is Preston. Thanks for tuning in today. This is the first intro video to what I hope is a really beneficial resource for a lot of you out there. I just want to give you a little background. So this channel and this video series is called Med to Sell. And essentially what this is going to outline is my transition and my experience going from a healthcare provider role. I was a physical therapist, licensed and practicing for about 10 years, and recently transitioned more into a sales role with a medical device sales company, specifically Medtronic. But what this is really going to serve to do is just kind of outline some of my experiences of where I was and, what kind of led me to the change, and then where I am now, and hopefully, where I'm trying to go with this move. I found that, during my transition process, there really weren't a lot of resources out there for me. I saw some things where, it was kind of targeting some people with business backgrounds or marketing backgrounds or maybe just a college graduate, but it wasn't really, specifically geared towards healthcare providers. And I've found that a lot of people in situations like I was in, they might have been interested in this realm, but they really never had a means of going about it, or at least some guidance through the process. And I'm really hoping that's what I can change, because what I've seen is that we are well suited for this industry, in the right situations and right scenarios. And it definitely isn't for everyone. But I kind of found out that physical therapy wasn't for everyone either, right? I found out that, while I thought I was very good at it, and I provided really quality care, it really just didn't invigorate me or kind of light a fire underneath me to keep me moving more for the long term in that direction. So to give you a little background on my story, like I said, I was a PT for about 10 years in practice. And I think what I found is towards that tail end of that, when I really started looking more seriously into branching out and seeing, maybe a different career path that was out there, I had a few things that swayed me that direction. And one of those was I just got really beat down with the way the healthcare industry is. And I think specifically as a rehab provider, every year I saw more and more Medicare cuts coming. I went the last 5 years in my position without a raise, dictated by reimbursement rates. And I'll acknowledge that I think a lot of employers, regardless of the setting you're in the healthcare, industry, I think a lot of employers have it tough too, right? Like if they're getting their actual reimbursements cut from the payers that they accept patients from, I also understand that they can't just be out there floating raises all the time and, making their margins a lot smaller. So I don't necessarily blame the people that I was working for, but nonetheless, the situation was that I wasn't really going anywhere, right? And I think that kind of leads me to my next hang up that I had, and that was that it was very clear to me, early on, that my only two choices really for advancement were either to become more of just a typical senior clinician, where maybe I've been practicing for 15, 20 years and now I just have, the seniority in the facility that I'm in, or in my case, the home health agency that I was with, or moving more in towards a therapy or rehab director role, something of that nature. And neither of those were something that really, interested me. I felt like I had a really low ceiling, and it really didn't matter how hard I worked or how good I was. I really just wasn't going to make that progressive or proverbial next step. And so that lack of being able to advance, I think, in a profession or in a career, that one really drove me to thinking strongly about looking elsewhere. I had a lot of friends, that would say, well, why don't you just open your own business? Why don't you open your own business? And I think at the end of the day, for me, I found that physical therapy really wasn't my passion. Like I said, I think I was very good at it, and I really think I provided my patients with a strong, and valuable treatments and plan of care and things like that. But at the end of the day, it wasn't what was going to keep me passionate, I don't think, for the next 5, 10, 15, 20 years. So, for me, that's what drove me away from it. And I look at a lot of friends I have in healthcare. My wife is a provider, she's a PA, and we have friends and relatives that are MDs and DOs and dentists, and you name it, right? Speech therapists, occupational therapists. And I think it's just really a shame, because I find that a lot of folks in those professions, they really are altruistic. They really do want what's best for their patients. And unfortunately, we all get stuck in the middle between, we want to be a really good clinician, But unfortunately, the business side of things does get in the way, and it impacts, whether it's our quality of life or our time with family, it's our documentation time. I would spend an hour to 2 hours, probably every night doing documentation. My wife still spends probably 2 to 3 hours every weekend doing documentation. And, most of us don't even blink with it because we just accept that that's the way that it is and that's what comes with the territory. But for me, I said, you know what? If I'm not really loving exactly what I'm doing anyways, and I'm having all these other, things on top of my day-to-day or my quote-unquote 8 to 5 job, and I'm not getting any compensation raises or any, hey, you're doing a great job, bonuses, sort of things like that. To me, those things matter, and that wasn't something that was going to sustain me for a long time. So, in a nutshell, I just didn't find that staying in the position I was in was going to take me where I wanted to go for the long term. And that's when I started looking around. And when I started looking around and branching out towards some other careers, I think what really stuck with me is I really truly didn't want to leave healthcare altogether, because I really do care about patient outcomes, and I care about people, and those things that brought me into the physical therapy profession, they aren't gone, right? Like I won't ever be able to just not care how a patient or a client does. Like that's just my human nature and how I'm wired. So I wanted something that I could stay within the healthcare realm, but I also wanted something that I could advance more within. I wanted my ceiling to be raised, both just from a professional standpoint and also from an income standpoint. I think sometimes we are scared to admit that, but it's the truth in my case. And so when I started really looking at it, I said, medical device and that world and being like a rep or a consultant, I kind of get the best of everything, right? Because I get to still have my foot within healthcare, but I don't have that responsibility of the patient and the liability and, the patient's either getting better or they're not under my watch, right? So that's been removed from the equation. But I also am in a realm where, the whole job is going to compensate you based on performance. So, one of the things that killed me in my therapy role was people that would do a terrible job would get the same exact compensation as I would. And that just made no sense to me, right? But at the end of the day, my license is no more beneficial than their license, right? Blue Cross Blue Shield is going to pay the same amount regardless of if it's a crappy PT visit or it's a good PT visit, right? Crappy therapist or good therapist. So I felt like in the medical device role and realm, it matters how good you are, right? Like it's an outcome. You're either good and you have results, or you're not and you leave. And I liked that because it really put me more in control of my earnings and my success. And so that was another reason that I started looking towards it. And the third thing is, and I'm not, ashamed to say this either, is I really wanted a job that was pretty autonomous. I wanted a job where it was, or I shouldn't say job, a career where it was, hey, these are your expectations. This is how you're going to thrive and survive, right? With this company or in this role, go make it happen, right? And I felt like my last 5 years doing home care physical therapy, I was doing that anyways, right? I was scheduling my own visits. I was, planning my own routes. I was submitting my own documentation, setting up, everything I needed to, ordering equipment. So I was doing a lot of those things. I was pretty autonomous anyways. And I didn't want to get rid of that. I did not want to let that go because that is still very important to me too, and that's what makes me feel like I do have my own business, even though I may not be on the name of the LLC, right? So that was very important to me that I found something in that realm as well, and I did, and I found that within the medical device sales industry. So that's just a little bit more about my story, and I think, I'm going to have a lot of topics that I try to go over. I'm sorry the sun is like hitting me right at this terrible spot, but I'm going to have a lot of topics that I try to go over in these videos. And unfortunately, most of them for you will all be with me driving because that's where my downtime is. So I apologize about that. But I'm going to have a lot of topics because when I was going through this process, like I mentioned, there just wasn't much guidance. And I look at it now and realize that I was very fortunate to land the role that I did and with the company that I did and the division that I did, because there are a lot of people trying to break in to the medical device arena. And I realized that without a sales background and without a business background, I really had an uphill challenge with that. And I'm very fortunate to be in the position that I'm in. And taking that a step further, I also then acknowledge how hard it's going to be for some of you to break into that industry and to really prove your worth and that you deserve a shot, at one of these roles. But with that, I also see how valuable we are in them, and I see how great that we can be as previously practicing healthcare providers, because we have such a different perspective than a lot of people do. And I want you to be able to harness that, and I want you to be able to verbalize that as you create your story around why you would be a great fit for a job or a position that you find open in this type of industry. So there's going to be a lot of videos coming, a lot of content that I hope is really valuable to you all. I would love to have feedback on, if you agree or disagree with my opinions or viewpoints, but also if you have other questions that maybe I haven't answered just yet and you've really been curious about, I'd be happy to help answer those and give a little bit more of my perspective in that area. So please don't feel bad about reaching out if you need to. But otherwise, you can find me on YouTube, Instagram. I'm going to try to have a pretty big media presence just so people can find me. But I look forward to many more videos to come. And if you have any questions, please don't hesitate to reach out. I would love it if you'd subscribe to this YouTube channel if you haven't already and you're listening on YouTube, because the more people I can get in contact with, the more people I can help and really show that we have we're a valuable asset to the medical device industry. Thanks, everybody. Make it a great day. Thank you.